Hello and welcome everybody. Today we are going to be talking about the types of causes, symptoms, and treatments for diabetes. So what is diabetes? Well, that's a good question. The CDC, or the Centers for Disease Control, says that diabetes is a chronic, long-lasting health condition that affects how your body turns food into energy. For a non-diabetic, the process is when your blood sugar goes up, it signals the pancreas to release insulin. The insulin then allows the blood sugar to go into your body's cells to be converted into energy. This is not possible for a diabetic because they can either A, not make their own insulin, or B, they cannot use the insulin that their body produces. There are three types of diabetes: type 1, type 2, and gestational diabetes, which is diabetes while pregnant. There is also prediabetes, which is a less severe version of type 2 diabetes. There are many symptoms of diabetes. The CDC on their website gives a list of them. They include urinating a lot, often at night, thirst, losing weight without trying, hunger, having blurry vision, having numb or tingling in the hands or feet, feeling very tired, having dry skin and sores that heal slowly, and having more infections than usual. All of these combined are telltale signs that somebody could have diabetes. The National Institute of Diabetes and Digestive and Kidney Disease says that symptoms of type 1 diabetes can start quickly, in a matter of weeks. This is the first major difference between type 1 and type 2 diabetes. With type 2 diabetes, symptoms often develop very slowly over the course of several years, according to the National Institute of Diabetes and Digestive and Kidney Disease. Many people with type 2 diabetes have mild symptoms that they won't even notice, and some have no symptoms at all. And most people don't find out that they have diabetes until they have a diabetes-related health problem, such as blurred vision or heart trouble. There are causes to diabetes, though. For type 1, the CDC says that scientists think that type 1 diabetes is caused by an autoimmune reaction. This means that the body attacks itself by mistake. So that stops your body from making insulin. The CDC also says that type 1 diabetes is usually diagnosed in children, teens, and young adults. And if you have type 1 diabetes, you'll need to take insulin every day to survive. Approximately 5 to 10% of people who have diabetes have type 1. This means that 90 to 95% of people who have diabetes have either type 2 diabetes or gestational diabetes. The American Diabetes Association says that type 2 diabetes is the most common form of diabetes, and it means that your body does not use insulin properly. While some people can control levels with healthy eating and exercise, others may need medication or insulin to help manage their blood sugar levels to help counteract type 2 diabetes. This is the second major difference between type 1 and type 2 diabetes. Type 1 diabetes, your body cannot make its own insulin. On the other hand, with type 2 diabetes, your body can make its own insulin, but your body cannot use that insulin for some reason. There's also prediabetes. Now, this is a less severe version of type 2 diabetes, because blood sugar levels are higher than normal, but are not high enough yet to be diagnosed as type 2 diabetes according to the CDC. Prediabetes also raises the risk for heart disease, stroke, and type 2 diabetes, obviously. These are startling statistics. The CDC says that in the United States alone, 88 million adults, which is more than 1 in 3, have prediabetes. What's even more astounding is the fact that more than 84% of them don't know that they even have it. Now let me repeat that. 84% of them have no idea that they even have prediabetes. However, prediabetes can be fixed by maintaining a healthy diet and other lifestyle changes like exercising and losing weight to help lower blood sugar levels. And last but not least, there's gestational diabetes. The CDC, or the Centers for Disease Control, defines gestational diabetes as diabetes that has developed in pregnant women who have never had diabetes. The National Institute of Diabetes and Digestive and Kidney Disease says that scientists believe that gestational diabetes is caused by hormonal changes of pregnancy along with genetic and lifestyle factors. This gestational diabetes, if not treated properly or soon enough during the pregnancy, can affect the well-being of the child after birth and later on in life, and they could eventually contract type 2 diabetes because of that. As of right now, there are no known cures for diabetes, but there are treatments, such as taking insulin shots. There are multiple ways to take this. You can take it in a syringe form, there's a needle form, there's just so many ways that scientists have developed to be able to, for diabetics to be able to get insulin into their bodies. There's also oral medicines that can be taken as well to help control blood sugar levels. There are also changes in lifestyle that can be made to help control blood sugar levels as well, such as diet change, losing weight, exercising, being more active. Many people have diabetes. Some of the famous ones that have them are Tom Hanks, Nick Jonas, George Lucas, and tennis player Billie Jean King. This goes to show how they can do stuff that they have done and they don't let their diabetes affect them. That should be the same for everybody else that has diabetes. You can't let the diabetes affect you and the way you want to live. All in all, diabetes is a treatable disease if symptoms and causes are spotted early, treated appropriately, and lifestyle changes are made. Thank you and have a great day.